All right, we're going to get started and hopefully a few people will trickle in. I know that everyone probably has a busy day coming up and we only have about an hour for the session, including questions and answers. So let me first start by introducing myself. I'm Lisa Meetop, Director of Events and Programs at Center State CEL. So thank you for being here today. Wanted to let you know that today's program, making sure you're in the right program today, is Understanding Childcare Subsidies, basically assistance available to employees. Just so you all know, we have a great panel that's going to talk about a few different things. So just to give you a quick description of what we're going to chat about today. So the cost and availability of childcare creates challenges for both individuals and employers seeking to retain valuable employees. So this topic is very important. Speakers today are going to overview the childcare financial assistance available to Onondaga County residents, which includes assistance for families. The assistance covers most and sometimes all the cost of care. As an employer, you're going to learn how you can help current and prospective employees access the benefits and help more individuals get the care they need while contributing to your organization's workforce. So very important topic. I know I'm a mother of children, so I know there's a lot of employers and employees out there that have children. So to us, this is a huge topic. So I'm going to quickly go over who our two speakers are going to be today, and then I'm going to pass it over to our experts. So we're going to start with Lori today. She's dedicated to her career to improving the lives of children and families in New York State through various nonprofit leadership positions. Since 2013, Lori has been the Executive Director of Childcare Solutions, which is the child care resource and referral agency for Cayuga and Onondaga counties. She's an active member of the Early Childhood Alliance, serving on several committees, including the Leadership Council. And Lori's greatest joy is being the mother of two accomplished professional young women and the enchanted grandmother of two delightful grandsons. After Lori speaks, we're going to have Sarah speak. Sarah has over the last 9.5 years, Sarah has been the commissioner of the Onondaga County Department of Social Services. The department is responsible for temporary assistance, SNAP, HEAP, child care subsidies, child support, and Medicaid. This department employs slightly less than 400 employees. So prior to becoming the commissioner, Sarah served as the department's program coordinator for 10 years. This included oversight of 500 plus contracts and working on homelessness and housing issues. So with that being said, two incredible leaders in this community, experts in this topic. So I'm going to pass it over to them because they know all the good information. Just so you all know, this is being recorded, so you can review it again at the end, and we'll have Q&A at the end as well. So I'm going to pass it right over to you, Lori.
Thank you. And yeah, next slide too, please. Thank you. So first of all, I want to thank everyone for joining this morning. One thing that the COVID-19 pandemic has really shone a light on is the essentialness of childcare. And I've been doing this work for many, many years now, really trying to engage employers around the importance of childcare for their employees. And I would say the pandemic has been the impetus for people really finally starting to pay attention. So I'd like to talk a little bit about how childcare impacts employers. And next slide, please. So when you think about the cost of care, if you had an infant toddler in Onondaga County in a childcare center, the cost would be about a little over $24,000 annually. And for a married couple in Onondaga County with a median family income of a little over $61,000, that would be about 40% of your household income. In many cases, more than rent or mortgage. And then consider if it's a single earning household, it's even higher percentage. So it's very unaffordable for even middle income families. Next slide, please. We did a 2020 cost of care survey showed by the Childcare Aware of America how it impacts the parents. So 94% have said that they've used at least one major cost saving strategy, and that included reducing their hours at work, changing jobs, or leaving the workforce entirely. And I'm sure as employers, you're all well aware of how costly that can be to the company in terms of recruitment, retention, and training. So next slide, please. Again, Childcare Aware of America, over a 6-month period, 45% of parents said they were absent from work at least once due to childcare breakdowns, and it was for an average of 4.3 days. A majority of these parents' work schedules were affected with a challenge by a childcare challenge, an average of 7.5 times in a 6-month period. So basically 15 days out of a year where childcare is impacting their ability to be present at work. And US businesses shoulder an economic loss of over 12 billion, almost 13 billion each year due to childcare breakdowns. Next slide, please. This March, we conducted, the Early Childhood Alliance of Onondaga County conducted a parent survey that shows locally the impact. So again, 40% did not take a job or quit a job within the past year because of childcare issues. 15% went to part-time work because they couldn't find full-time care. 26% turned down a promotion as a result of childcare issues. 78 left the workforce early, and 68 arrived late. So again, you all are well aware of the cost to employers. And 83% missed work in the past year as a result of it. This has a direct impact on operating your business. Next slide, please. Another study in 2018 that was done locally here by Childcare Solutions and Early Childhood Alliance showed that 34% of parents felt distracted at work because they're concerned about the safety and quality of the care that their children are receiving. Again, about 42% arrived late, another 55 left work early, and 55% called out from work altogether. The percentages don't add up because some people check multiple things, but again, it's a huge impact on local employees as well. Next slide, please. So what do we do about it? How can employers help their employees find childcare? And in the past, employers felt like this was not my responsibility, but Childcare Solutions is a free service. It's a benefit to your agency, as a business and for your employers. Our vision is that every child is cared for in high quality, safe and nurturing environment that cultivates healthy development, early learning and joy. And when we say every child, we truly mean every child, not just those in families that have the resources to afford the high quality care. Next slide, please. Our mission is building excellence in the early care and learning system while advancing equal access for all children in our community. And we accomplish this through education, advocacy, and support for families and early childhood professionals. So I'll talk a little bit about some of the programs that we offer. Again, information and referral to families in our community about the childcare resources, and that we'll get into in more detail. But next slide, please. So if you have employees that don't have a childcare provider, tell them to call Childcare Solutions. Again, it's a free service. They give our parent services specialist a call, and we'll give the contact information later. They can walk into the office, they can email. The parent service specialist is going to ask each family some questions to try to get a feel for what is it that their family specific needs are around childcare, not just location and hours of care, ages of the children, but really what type of care are they looking for, and then providing information about what high quality care really looks like. Once they have gathered that information and helped the parent to identify specifically what they're looking for to meet their family's needs, they're going to generate a list of the registered and licensed childcare providers in our community that will best meet that family's needs. And so unlike some of those online services that you can just Google and get, a list of referrals for childcare, these are people that meet the New York State Office of Children and Family Services regulations to operate a childcare business in our community. So they have been vetted through, criminal history background checks, cleared through the State Central Registry for Child Abuse and Maltreatment. They've had reference checks before they can open their business. There's an inspection done of their home to make sure that they're meeting all of the requirements. And then they're inspected at least annually and in many cases quarterly. Next slide, please. In addition, we have available a parent guide that is available both online on our website. You can certainly call our office and request printed copies if you would like. And the guide includes all kinds of information about what to look for quality, what types of care are available, how much care is going to cost, referrals to Sarah's program for funding for childcare, and tax incentives and things like that. It includes a checklist of things to look for when you're visiting a program to interview the provider, and just a plethora of information that we encourage people to access, and again, free of charge. Next slide, please. So our contact information, we do have our main phone line, also a toll-free number if people are concerned about the calls, the fees. You can email parent services and they will contact back, or visit our website and you can either learn more information. All of that information is available on our website. You can also fill out an online referral form and someone will contact you back and provide access to referrals that way. We do encourage people though to either call or come in person to get that high quality personal touch from our childcare specialist to really help them identify specifically what their family needs versus just filling the form out. And again, we have offices both in Syracuse and Auburn, and there are sister agencies like ours throughout New York State and actually throughout the country. So if you're not from Onondaga County, you can still contact our office and we can refer to other programs in the state or country. And next slide, please. So Sarah's up. Thank you.
Thank you, Lori. Good morning, everyone. So if you remember the first slide that Lori talked about, that it costs $24,000 for a household if they have a toddler and a infant in care. I'm going to talk today about how it can become affordable now for working families. So the Department of Social Services, one of our requirements is to assist people in helping them find the funds to help them make childcare affordable. If we can go to the next slide. So I really, this is an incredibly exciting time for families. Childcare is finally affordable in New York State. Between changes that happened at the federal level, allocating billions of dollars in childcare, and then the latest New York State budget that was passed back in April, where they made some significant changes in who is eligible for childcare assistance. Childcare is truly affordable now for the vast majority of working families. So what happened in April at the state level? The state expanded the eligibility level. So now it's 275% of poverty over the poverty level, and I will get into some numbers so this doesn't sound like Greek to you all. And then then August 1st, it becomes 300% over the federal poverty level. What is also really key here is Onondaga County used to be probably one of the most expensive places for childcare, due to the fact that our parent share was set at 35%. And that was for a host of reasons. That was set a long time ago when there wasn't a lot of federal and state resources, and the local tax dollar was a significant portion of paying for the parent portion of childcare. But again, I'm going to reemphasize the changes at the federal and state level this year have allowed us to go from 35% parent share down to 10%. And just recently, a couple of months ago, we were able to even lower it to 1%. And in a few slides in a minute, you'll see how significant this is and how truly affordable childcare is for families. And then childcare assistance, we used to have to monitor families' income every 6 months and kind of do a redetermination on whether someone was eligible for assistance or not. This has now been pushed out to every 12 months. And in addition, if after 12 months a household has earned more and is no longer, quote, eligible for assistance, they have a full year transition year. So in essence, if you become eligible, a family becomes eligible for this assistance, you pretty much got a guarantee of 24 months of assistance to help you with your childcare costs. Next slide. So this just gives you an idea of an example. A 4-person household, mom, dad, 2 children, parent, an infant, and a toddler. The annual median income that Lori referenced in her first slide, a little over $61,000, and the average cost of care for an infant and a toddler, a little over $24,000. When the parent share of childcare assistance was set at 35%, the parent was still obligated to pay out of pocket almost $12,000 a year for 2 children. And when you look at that as a portion of $61,000, that was a significant burden on the family. And often we would talk to families and they said it's just not worth it to take the subsidy because it really is not offsetting childcare costs enough. Next slide. So this is how dramatic the change has become. Same family, same annual income, same cost of 2 children, but you can see now reducing the family share to 1%. For 2 children, the cost for a full year is $336 a year for 2 children per year. I'm not talking about per week. This is the total cost per year. And that's why I kept saying now childcare is really affordable for working families. Next slide. Thank you. So this gives you a quick idea. Again, we at Onondaga County Department of Social Services, we have a whole childcare assistance eligibility team. And we really have to look at everyone's particular income situation to figure out if they're eligible or not. But this gives you a ballpark on, and it gives you a ballpark on what you're paying your employees and what employees would be eligible for childcare assistance based on the 300% of FPL, which is the federal poverty level. And again, right around the corner, August 1st, these families will be eligible for childcare assistance. And you can see based on the parent share being 1%, you can see how affordable now for 1 or multiple children. It does not matter if 1, 2, 3, 4 children are in childcare now. The total cost for 1 or more children for the family at 1% are these numbers: $366 for a family of 2, et cetera, et cetera. So, I mean, this is life-changing, I believe, for these families. All right, yes, anyone? Yes, anything lower. These are the max incomes for the household side. So any income less than these maximums, they're definitely eligible for childcare assistance. Next slide. Okay, And again, just to make it even more graphic, single parent, one child, working a little over minimum wage, the annual family cost will be about 300 and a little less than $348 a year, or in simple terms, $2.63 per week. And again, this $2.63 per week could be for one child or 2, 3, 4 children. It does not matter how many children when it comes to the parent share. Next slide. Okay, so what we need to really do is get the word out that they need to contact the Department of Social Services and talk to our staff and apply for assistance to see if they're eligible. We'll help them out filling out the application. We'll explain what the parent share responsibility is. We then work with your provider that you've selected, and we directly pay the provider what is owed to them, and then you, the parent, pays the provider that parent share directly to the provider. So obviously, two payments, two funding sources. We cut a check to the child care provider, and then the parent is responsible for paying that family share. And again, it depends upon the arrangement they have with the provider, if it's weekly or if they want to do a monthly payment for the whole month. No, it's never too early to contact us. It's better to get started. We have expanded our daycare unit, knowing full well that a lot more people are going to be applying for assistance, and a lot more people are going to be eligible, and we really want to be as helpful as possible. Next slide. So you need to first find childcare first, then contact us. And then, as I said before earlier, again, this is very exciting. If you are found as a household found eligible, really in essence, they're going to be eligible for a minimum of 24 months. So it's a guaranteed 2 years that childcare assistance will be available for that household. And the assistance can be used in any childcare form. They have to be licensed and regulated, but it can be home-based, it can be center-based, it can be legally exempt provider, and it can definitely be for after-school care. Next slide. Yes, there is some funding outside the child care assistance that I am talking about for people that are over income. You would be going, they would call back to Lori Schakow's organization, Childcare Solutions, to learn about those opportunities. And it is, I think every employer needs to know this. There is zero cost to the employer. This is all through public tax sources, whether it's federal, state, or local dollars, but is it completely free to the employers. We just need employers to get the word out to their employees. And again, you can see that the parent's responsibility is now only 1%, and it is now truly affordable for many working families in Onondaga County. Next slide. So just a few things, just want to make it really clear. Asset limits, we do look at people's assets. If a household has over $1 million in assets, that would be a disqualifying eligibility factor. However, I don't know that we've seen a lot of that. So I really think this is something that we really don't need to worry about. Most people, if they are fit into those 300% over the federal poverty level or less, will be eligible. Time limits, as I said, Again, minimally 12 months, then a transition, another 12 months if you are over income at the point of redetermining your eligibility. But obviously, if you're not over income, these can continue until your children age out of childcare, which is after 13, age 13. Educational limits. This is a big change. This is one of the changes that the state in this latest state budget passed. They discontinued barriers to getting childcare assistance if someone was seeking a 2-year or 4-year college degree. Before these individuals would have to be working simultaneously and going to school, meaning college, a 2-year or 4-year college. They would have to be working minimally a part-time job to be eligible for childcare assistance. Those limitations have been eliminated. And basically, if you're a full-time student, you will be eligible for childcare assistance. And employment limits. There used to be many variations on what type of employment, how many hours you were working. And again, in this New York State budget, they took a lot of those barriers away. So I want to really emphasize that if an employee of yours applied for childcare in the past and got denied, they really need to try to apply again, because the eligibility criteria has changed so significantly over the last couple months that it's definitely worth someone applying and finding out if they're eligible for childcare assistance. So again, I know it's a little bit of time consuming. We at the Department of Social Services are going to try to make this as easy and as painless as possible and quick as possible, but it's definitely worth an employee's time to see if they're eligible for any childcare assistance. Next slide. So I know that this is a webinar that's being seen across multiple counties. So each county had a choice to set the parent share between 1% and 10%. Obviously, Onondaga County and Oswego, we decided to make it, we got it down to 1%, and because we really are trying to meet the needs of where employees are and understand that employers need to get employees back into the workplace and keep them in the workplace. And childcare has always been a barrier in that process. So we have chosen to set the parent fee at 1%. Cayuga, Cortland, and Madison have set it at the highest level of 10% now. Next slide, please. So you could always find information about daycare or childcare at our website. Our application, our forms are all there. We have walk-in hours on our second floor, 8 to 4, so you can talk to anyone. You can mail, fax, or email our application, and you can call us and if you have any questions. So again, I want to emphasize that childcare is truly now affordable for working families, and it does not hurt any employee from applying and finding out if they are eligible for childcare assistance. I want to highly encourage that. So please promote your employees finding out if they're eligible. Next slide. Okay, I think we're back to Lori.
Yes, thank you. And before we go to the next slide, I just want to mention, Sarah alluded to the legally exempt childcare providers. And when I talked earlier, we spoke about the registered and licensed care that meet the OCFS regulations. Legally exempt providers are those people that are not required to get a registration or a license in New York State, typically because they're caring for all relatives, or they're caring for less than 2 children for less than 3 hours a day. So if someone, really says, I want to use a family friend or neighbor to care for my children, and that's an option that parents often use, particularly with very young children. They don't want their infants in care of a stranger, so they want a family member to take care of them, or parents that are working, strange schedules or overnights and evenings. It's often hard to find regulated care for that. So they may choose family, friend, and neighbor. Those people are still eligible for the funding, for the childcare assistance. So what they would do is, when they contact Department of Social Services to find out their eligibility, they inform the caseworker that I'm going to be using my grandmother for childcare. They'll give them what's called a legally exempt enrollment application. So they still do need to, the provider still needs to enroll with us. And it's basically a mini version of the registration or license procedure. They still have to have a background check and a state central registry for child abuse and maltreatment clearance. They have to attend a health and safety training prior to receiving the subsidies. And the reason for that is that we want to make sure that taxpayers' dollars are going to somebody where the child is going to be safe and well cared for. But they really can choose anyone they like, with the exception of, somebody that's not going to meet those criminal history background checks or whatever. So with that being said, this is wonderful. My employee has found childcare, it can pay for it. What else can I do as an employer to make childcare easier for our employees? Next slide, please. So some of the other barriers around childcare are just the workplace practices that are in place. One of the things that, as an advocate for childcare and children and families, we really truly encourage employers to promote generous paid family leave for all parents, moms and dads, giving them the option to bond with their children and to meet some of those childcare needs that are particularly challenging for infants or when there's ill children. Approve use of the employee's sick time to take care of their ill children. A lot of times parents send their kids to childcare when they're sick because they can't afford to lose time off from work because they're not going to get paid. So allow your employees to do that. And then think about family-friendly work schedules. So one thing that is really, really challenging for both parents and providers is when their schedule changes from week to week and they get notified on, Friday afternoon or Saturday that this is my schedule for the next week. There's no way to plan effectively for that. And how it impacts childcare providers is they have to maintain ratios of adults to the number of children in care. And if you don't know from one week to the next whether you're going to have 6 children in care or 8 children in care, it makes a difference in terms of the staffing pattern. So plan your schedules. If they are rotating or flexible schedules like that, plan them far out in advance so that both parents and childcare providers can really plan for that. Take into consideration childcare and school drop off and pickup times. Somebody was mentioning earlier that they have to pick their child up at 4 o'clock and they don't get out of work until 5. That's a challenge for parents. So, keep those kinds of things in mind. Particularly for families with very young children, try to not schedule them for the late night and overnight shifts. How many people would really want to put their baby to sleep in not a stranger's, but a childcare program or, a home? And then, really think about flexible work arrangements. Are there options to do, some hybrid work from home, those kinds of things to help families, better meet their families' needs as well. And I think as employers, again, one of the things that this pandemic has really shown us is that's becoming an expectation of employees as you're trying to recruit and retain. employees are really looking for that flexibility in their schedules. And then another example is something that Childcare Solutions has implemented for as long as I've been here. And it's actually something that my daughter's 37 years old, and I had the option many, many years ago as an employee at SUNY Oswego to bring my baby to work for the first few months of work. I know it's not ideal in every setting, but if it's something that would be conducive to your workplace, it's an amazing way to bring parents, moms especially, back to work sooner, if at all, because many moms, opt to not go back into the workforce. And we set limits so the children can come until they're mobile, because it's then not a safe setting for young babies. But they also have to have backup care, so that if they're working with a customer or on the phone and the child gets fussy, somebody else will step in. We work with mostly women, so it's really not a problem. And quite honestly, some of the men in our office are some of the better childcare providers when it comes to soothing babies. So think about those kinds of things when you think about your work practices. Those are, inexpensive, low-cost benefits that you can encourage your employees to retain at work or even come to work. So next slide, please. So some of the resources and takeaways. Again, I mentioned the parent guide. It's about a 20-page document that's just chock full of probably more information than anybody is ever going to want to know about childcare, but it's a great resource for parents that want to know about what types of care are available in my community, what the costs are, what resources are available, and then the financial assistance flyer, which again, these resources will be available to you after the program. And next slide, please. I think we're done. Thank you.
I think we're open to taking questions from the group, and I'll start us off. My name is Lori Black, and I work with the Early Childhood Alliance, and I will start with a question for you, Lori, about quality. But if you could do two things in this question, could you just briefly describe the different types of care? I know you've talked about them a little bit, but go through center, family, group family, and just describe what they are in a very short way, and then talk about how parents can know how to recognize quality in a childcare center. So when parents are looking around and trying to identify where they should be placing their child, how do they know how to think about quality?
Exactly. So a childcare center is a business that is not in a residential setting. So it could be, a standalone building. It could be located in a church or a school building, but it cannot be a resident. And they typically are caring for large volumes of children. So there are very stringent regulations around the setting for childcare in terms of, fire safety codes and doors and windows and exits. And then as we mentioned earlier, the child to adult ratio. So in an infant classroom, for example, you can have no more than 4 babies under the age of 24 months per adult in the classroom, and no more than 8 babies total. And those ratios go up as the children get older. So in a school age classroom, they could have up to 20 children with one adult. And the reason for that is obviously safety and making sure that the children are getting high quality care. A family daycare provider is someone that provides care in their home, in their own home. And again, there's an inspection done. The background checks are done on all family members who reside in the home that are over the age of 18. And it's one individual, and they can care for up to 6 children full time. And then they can take an additional 2 school age children that are there only after school or during holidays and vacations. A group family childcare provider also provides care in their home, but they're working with an assistant. So 2 childcare providers, you're basically doubling the numbers. They can have up to 12 full-time children, and then 4 additional school age during after school and holidays and vacations. And then a school age setting or a school age program doesn't necessarily have to be in a school, although many of them are. But again, it's not a residential setting. It's in a standalone or another building away from residents. And they care for children kindergarten and up to age 13. And again, the ratios are much larger. Some school age programs recently, as a result of the pandemic, have been able to take on preschool programs, but because the regulations are very different around the preschool children, they have to keep them separate from the older school age children. And so there's very few programs in our community that actually provide care for the preschoolers. And then, of course, there are preschool programs through school districts. And in some cases, those preschool programs contract with the childcare centers to provide that care. So the preschool program may actually be either in the school district or in the school building or in the childcare center. But they are, they have to meet not only the daycare regulations, but also the school district regulations in terms of curriculum and things like that. When parents are looking for quality, so parents often will contact us and say, I want you to give me a recommendation, like who should I use for childcare? And that is a very, very personal decision. Every person and every family is going to have different needs and different things that they're looking for their children in care. If you have a very active child, you may want a childcare program that, does a lot of very active, energetic, burn some of that energy off kinds of activities where, my children were much more comfortable with a caregiver that was more like their grandmother, who was going to sit with them and read and, do outdoor activities as well, but just a calmer pace. So it really, like, every parent is looking for something different. So you want to look at, is this caregiver somebody that I can communicate well with? Is this the type of, the environment that I want my child in? Visit the facility and make sure that it's safe. Again, we inspect on a regular basis, but it's not eyes on the program all the time. So it's still parents' responsibility to make sure that your child is safe. When we go in and inspect, we're looking for things like, are the outlets covered with, protective caps, and are all medicines locked or stored safely away so that children don't have access. But again, we're only there, maybe 3-4 times a year. So parents need to monitor those things on a regular basis too. Also look for their education. What types of, in many cases, it's somebody with an education degree. Others have a child development associate, or they are required to attend 30 hours of training every 2 years. So take a look at what are some of the trainings. What's their discipline policy? What's their payment policy? What are their, holiday or absences policies, things like that. You want to make sure that this is a comfortable place that's going to meet your child's needs, that you're going to feel like they're safe and happy in that program and learning, what curriculum or what kinds of activities did they do. If you go in and ask to see, what's the plan for the day, and they don't have something posted or readily available so that what your child's going to be doing all day, it might be raise a red flag. So those are the kinds of things that we look for. Again, in the parent guide, we have a whole checklist of, some of those safety items to take a look at, and some of those questions that you want to ask the provider to make sure that they're a good fit for you and your family. Did that help?
No, that's terrific. Thank you. Are there other people who have questions? Feel free to unmute yourself. I have some others in case you don't, but if you have some questions, please, this would be a great time to unmute yourself.
Can I say one more thing about quality too? I'm sorry. So one of the other things that we always offer parents when they call us, and it's in our written material as well, is after you have narrowed your selection down and you're thinking about, 1 or 2 providers, not sure which one you want to choose, call us back and we can share the compliance history for that childcare provider. What was the result of their inspections? Have they had any complaints made against them? Those kinds of things. It amazes me that parents don't take more advantage of that opportunity as well. It's kind of like a care fax for your childcare. Sorry.
I just want to jump in because I saw one question about childcare assistance. Childcare assistance is available in every county. Every Department of Social Services has a child care unit. So this is a benefit that it's available in every single New York State county. So it's a statewide benefit. Again, the parent share may vary from 1% to 10%. It can't be any higher than 10%. But there might be a little bit of a variability there. But so anyone outside the counties we just discussed, they should be calling their local Department of Social Services and talking to someone on their daycare subsidy or assistance staff.
I don't see anyone unmuting themselves. So Sarah, I have a question for you. These are amazing changes for our childcare community and will hopefully expand the number of families who are accessing subsidies assistance. I know this is funding from the federal government and we can't predict what's going to happen in the future, but is there a role for the business community or the folks that are here on the call to be thinking about and thinking forward about making sure that we continue the momentum? What would you suggest that possibly the business community could do now that these changes are in place and we want to maintain them?
Yeah, I think that, we have enough federal funding, partly due to the pandemic, which caused a dramatic reduction in utilization of childcare across New York State and across the country, to be perfectly honest. So we had a lot of rollover funds, as well as the pandemic also said, oh, we have to do something about shoring up our childcare system. So the federal government expanded their funding of childcare and in essence passed that on to New York State. And New York State and the changes that they have made really are utilizing the vast billions of dollars the federal government have allocated to childcare recently. So again, I think there's enough money in the pipeline for 2 to 3 years for this incredible opportunity to last, meaning that childcare is finally affordable to families. But this is the time where employers and employees need to make sure that they are talking to their elected officials to say, okay, let's not make this just a one-time opportunity, but let's make this a lasting opportunity. And that means that really there's going to have to be decisions made at the federal and state level sooner than later. And at the state level, talking about billions of dollars allocated for childcare assistance so that this is sustained. And I think that's critical for the childcare system. It's going to be critical for the economy of our state. So employers really need to look at that if to get reliable employees who are not distracted because they're concerned about the welfare of their children, it's important for our employers to talk to their elected officials to say, this is something that we need to have continuous investment in so that I can have my best employees focused at work and that we can have children in safe, affordable, and in an environment where they're learning. And that's a win-win for the current work generation, but the future work generation. So let's act now, because 2 years, maybe 3, will be gone like that. And then we're going to go, this costs a lot of money and the money isn't no longer in the pipeline. And then we're going to have another crisis. And we can avoid having another crisis and really have continuity of reliable care. And it really is a win-win for the economy and for any employer.
Another question for you, as we think about, we've emphasized that we go to Childcare Solutions if we have questions about where to find childcare, what childcare is available. And we go to Department of Social Services if we want to apply and submit an application to qualify for assistance. Can you talk a little bit about what is the experience when I call the Department of Social Services to get connected to something in the childcare division? Do I get assigned a worker? And then about how long does the process take to review the application?
Yeah, you are assigned to, a parent is assigned to a worker, an eligibility worker, and who will be requesting verification of one's income. And that's pretty much all we need to look at. And then reviewing the circumstances of one's employment. Again, we used to have to do a lot more of that, but now what we're going to have to review will be a much reduced checklist, in my opinion. And we hope we really try to turn an eligibility decision around in 30 days. So we do have timeframes we have to meet. So we try to work within that 30-day time frame. I would want to emphasize that in a parent who calls either place, Childcare Solutions or the Department of Social Services, we'll help you get to where you need. Okay, we work together all the time. We are very, very, very connected. So I don't want a parent to get hung up on, oh, I don't know who to call first. Just call one of us. And then we will walk a parent through the process either way. Lori's team is fabulous. And I think Lori's nodding her head that we really do have a very strong partnership, and we will walk a parent through whatever steps they need. Okay.
One of the beauties of the support from Onondaga County that's been amazing in the childcare arena is that there is a Childcare Solutions staff person at Department of Social Services Monday through Friday all the time. So essentially, if someone walks into that office or that building for either service and they need access to the other department as well, it's a one-stop deal. Like they go to Childcare Solutions and they get referrals, and then they go next door or upstairs to get the childcare subsidy, or vice versa. They go get a subsidy and then they need childcare, they can stop into the Childcare Solutions. And quite honestly, traffic in our office at Department of Social Services has really slowed down because of the pandemic and the closure of the building for a while. So we encourage people to go there to get their needs met, because it really is a one-stop deal.
If not, Lisa, we can turn it to you.
Yeah, so thank you. Thank you, Lori, our other Lori, Sarah, everyone that presented today. We really appreciate all this information. Just so you all know, I will be sending out a follow-up email to all the attendees that will include some additional information in the flyer. And that'll give you the information that we provided today. And like Sarah and Lori said, please reach out. They're here to help you. So if there's something that Sarah can't do, I'm sure she can send you to Lori, and then Lori can send you to Sarah. They all work very closely together. So again, I appreciate everyone for being here today, and I will send out the information. And again, if there's anything you need from Center State CEO, please reach out as well. Thanks everyone, and have a wonderful day.